Well, the flu has certainly been widespread in South Carolina for a month now, and with every week, doctors say they are seeing more cases. Drugstores say they're not at risk of running out of Tamiflu. That's the common drug used to treat the flu, but they're starting to run low as they fill more prescriptions. Our Aaron Rodgers is live in Greenville tonight with more on what you can do to protect yourself. This is really important, Aaron.
It is, Tom, and the one bad thing about Tamiflu is that you have to catch those symptoms within 48 hours or else it doesn't work as well. But doctors tell me if you're a pretty healthy adult, if you do get the flu, it's outside of those 48 hours, you can pretty much treat it with just common remedies. I've kind of set it up here for you. Some of the things that they say work best, of course, they said like Tylenol, Aleve, those things, Advil can help. But just good old warm tea, honey, that can help. Add some lemon in there. Of course, you can't forget your chicken noodle soup. And they also say eat oranges, lots of them. A lot of people think maybe orange juice, but orange juice has a lot of sugar in it. So they say either just eat the orange whole to get the calcium, or excuse me, to get all the benefits of it, not calcium, that's milk, but also to squeeze it if you want the juice, if you just have to drink the juice, to squeeze it instead of buying juice at the store, because that could actually make you sicker.
We know the basics. Wash your hands, cover your mouth. But even with precautions, flu cases continue to rise.
We're seeing about 30% of our patients are presenting with flu-like symptoms.
Dr. Chelsea Bergen works for Greenville Health System's urgent care system called MD 360.
In general, it seems to be on the rise. You know, each week that goes by, I feel like there's a couple additional flu positive tests that come in every day.
Over the past week, emergency centers at Spartanburg Regional have seen 70 flu patients and say this January has been worse than last January. But it's just the beginning of the peak of flu season.
Lots of prescriptions for Tamiflu.
Scott Cowsey at Howard's Pharmacy says his supply is getting lower because of that, but is not in danger of running out.
Usually at some point in time you can find it somewhere. You just have to, dig, farther to find it.
But Tamiflu only works best if you start using it within 2 days of showing symptoms. And a lot of people may not know how to tell the flu apart from a bad cold.
Biggest thing that I've seen is the high grade temperature and the body aches. It will really set it apart.
Dr. Bergen told me it's not too late to get a flu vaccine, but it does take a couple weeks to kick in, and the flu is already widespread in the state. So if you do get it, this could help.
Basic little lifestyle changes like trying to cut out sugar while you're sick, trying to increase antioxidant foods or supplements.
So if you want to get your vitamin C, you can eat oranges, but doctors also say using elderberry is also a really good preventative measure if you do have the flu. But of course, every case is different, so before you use that, go ahead and consult your doctor. Live in Greenville, I'm Aaron Rodgers, 7 News.